Hello. This video will serve as a brief overview of the electronic medical record system for use by visiting medical groups in San Lucas Tolimán. The goal of the EMR is to allow visiting medical groups to view a patient's medical history and also log new information that future groups can access. This system has been made to work with minimal or no change to the common workflow that most groups follow. Getting set up. Upon arriving to the console, local personnel will set up the network. Step 1. Connecting to the network. The EMR can be easily set up on your own personal device, whether it be an iPhone, Android phone, tablet, or laptop. No internet is needed and the devices can be easily set up in the community. To start, go to your Wi-Fi settings. Turn your Wi-Fi on. The device can remain in airplane mode if you'd like. Now you need to select the proper network. In most cases, the network will be called Internet in a Box. Tap to connect to the network. If there is a password set, local personnel will inform you. Just to make clear, this network does not give you access to the internet. All it does is allow you to view and add new information to the EMR. Also, you will only have access to the EMR when connected to the specific network. Step 2. Accessing the EMR. Now that you're connected to the proper network, you can go to your browser. For iPhones, it is recommended that you use either Safari or Chrome. On Android devices, you should use Chrome. Type the following into the address bar: box/modules/EMR/v3/. Everything should be lowercase. If this address changes, local personnel will inform you. Once you're done typing, simply hit enter. You should now have access to the EMR. Using the EMR. This is the main page. The options on this page are built to facilitate the work of each station. Registry/browse are for those that will be registering new patients and checking in patients that are already in the system. This can be done by either members of the visiting medical group or by local personnel such as the health promoters. This application works in both English and Spanish. Ready for triage/intake are for those that will be handling tasks such as collecting a chief complaint and measuring vitals. Ready for medical consult are for the physicians that will be logging a diagnosis and deciding upon treatment. Completed consult today is a useful tool for the pharmacy to see consults that have been recently completed so that they can view the treatment prescribed by the physician. I will start by going over registry/browse. Clicking on this option will bring you to a list of patient communities. To check if a patient is already registered, you can either search for them or navigate to their community and look for their name. Let's say a patient shows up saying she is from Providencia. We can jump into Providencia and see a list of patients. The patient's name is Angelica and she is not listed. We can search for her to ensure she isn't registered under a different community. Since no results were found, we can register her. Simply tap the Add Person icon on the upper right. It will ask for some basic information. After answering the questions, you can hit Save. This will send you to the patient's profile. As you can see here, the patient has no previous consults since she was just created. In order to check in the patient, you can simply hit the Consult button. If you go back to her profile, you can now see that there is an active consult for Angelica. Let's go back out to the patient list for Providencia. As we can see, Angelica is now listed. Now, let's say that Amber shows up. She's already here on the list. We can simply tap on her name and go to her profile. As we can see here, Amber does have a previous consult. To check her in, we can simply hit the Consult button, which will start a new consult for Amber. If we go back to her profile page, we can now see her previously completed consult listed as well as her new active consult. Let's now go back to the main page. There is always clear navigation at the top of each page. The newly registered patient and check-ins that we just did can be viewed on any other device connected to the network. Let's now say we are in a completely different device and we are at the triage/intake station. Clicking on this option will bring you to a list of patients that have been checked in. Let's say Amber comes to our station first. We can simply tap on her name and we are brought to her active consult page. The consult is split into two main sections: triage/intake and the medical consult. Right now we want to log her chief complaints. Clicking on the chief complaint/HPI option will cause a pop-up to appear. We can tap where it says touch here to get a list of the most common chief complaints. Let's say Amber is complaining of a cough and a sore throat. We can mark these two options and click OK. As a note, there is an other option at the bottom of the list that will allow you to enter a custom chief complaint. Hitting save will save your selections and update the pop-up. If you'd like to enter more information about the chief complaint, you can tap on it. Various questions show up and all of them are optional. Let's close the dialog and go to the vitals/measurements section. As you can see, there are inputs for blood pressure, pulse, etc. Everything is optional. Let's say we only want to input a blood pressure and a weight. We can then save these. As you can see, there are check marks next to chief complaints and measurements to indicate information has been logged for these sections. Now the patient is ready to be seen by a physician. You can simply hit the button that says ready for medical consult and the patient will be placed in that list. If we now hit the home button, we can go back to the ready for triage/intake list and see that Amber is no longer there. Let's now go back to the home page. Let's now play the role of a physician who is on a different device. Clicking on the Ready for Medical Consult option will bring up a list of patients who have been marked as ready. As we can see, Amber's name shows up. We can tap on her name and go to her active consult page. Let's say the physician wants to see if the patient has had a previous consult. We can simply go to Amber's profile and see a list of her previous consults. As we can see, Amber already has a completed consult. We can click on it and get an overview of the consult. We can see the chief complaints, some vitals or measurements, a diagnosis, and a treatment. We can also see some information about the medical group that performed the consult. Now let's go back to Amber's profile and jump back into her active consult. The physician will want to see Amber's chief complaints, as well as her vitals. Now the physician decides to perform a lung exam and it comes out normal. After asking some further questions, it is decided the patient has a viral syndrome. The doctor can tap on diagnosis, and there is viral syndrome on the default list. Clicking on categories will show further options. Now let's go to treatments. Under treatments, all diagnoses will be listed as well as general treatments. Under general treatments, there are options such as vitamins. Let's say the physician decides to give 30 adult vitamins to the patient. Clicking on viral syndrome now will show a list of the most common treatments for that given diagnosis. Each of these lists have been customized for each diagnosis. As with everything else, there is always an other option to be able to write in a treatment that does not appear on the list. In this case, let's say we choose acetaminophen. We can save it. Now, under follow-up, we can decide whether the patient needs some sort of follow-up. Choosing yes will cause further options to show up. In this case, let's say no. Next, we can complete the form. Here, it will ask for some basic information. The correct options can simply be chosen from the drop-down list, and the consult can be marked as complete. Clicking on the newly completed consult will now show an overview of all the information collected. You can now go back to the home page and start with a new patient.